Cardiac Science Powerheart AEDs are the smart choice. They are the only AEDs that combine easy one-button operation with patented technology that makes them the simplest AEDs to use. The Powerheart AED is fully automated. Voice prompts guide you through each step you need to take to perform a rescue.
Tear open electrode package and remove electrodes.
But first, let's look at the special features of your AED. Every Powerheart AED comes with one pair of defibrillation electrodes with a simple diagram on each, one extended life lithium battery, and a quick start toolkit which includes everything you need to get started. The extended life lithium battery does not require charging. A smart gauge battery indicator provides constant feedback on the amount of battery life remaining. Be sure to stock your AED bag with towels, scissors, razor, and gloves. Only Cardiac Science AEDs feature patented rescue-ready technology, which tests not only the battery and system components, but also verifies that the electrodes can properly deliver a shock. The rescue-ready indicator assures you that your AED will work the first time, every time. The Powerheart AED can be used for adults and children. However, when the patient is under 8 years of age or weighs less than 55 pounds or 25 kilograms, the AED should be used with pediatric attenuated defibrillation electrodes. Therapy should not be delayed to determine the patient's exact age or weight. Now, let's look at the rescue procedure step by step. Put on gloves. Check for breathing and signs of circulation. As you were taught in your CPR class, make sure the patient is unresponsive and not breathing before attaching the AED. Call your emergency medical system. Loosen or remove patient's clothing to expose the bare chest. If necessary, wipe the patient's chest with a towel to remove perspiration. Lift the lid of the AED. Opening the lid automatically activates the AED. Listen to the voice prompt.
Tear open electrode package and remove electrodes.
Pull out the pre-connected electrode package. The electrodes are non-polarized, which means that, while placement on the chest is critical, either electrode can be placed in either location. Open the package by tearing along the marked bottom. You do not need to tear the package away from the electrode cable to use.
Peel one electrode from plastic
Grasping
liner.
the clearly marked corner of the electrode, peel away one electrode from the liner. Be careful not to touch the electrode surface. Now, following the easy diagram on the package, place the electrode under the collarbone, above the nipple, and carefully press down.
Place one electrode on bare upper chest.
Peel away the second electrode
Peel second electrode and place on bare lower chest as
and place it on the left side of the bare lower chest.
Check electrodes.
If you hear this voice prompt, check to be sure the electrodes are firmly attached to the patient.
Do not touch patient. Analyzing rhythm.
It is important to avoid touching the patient while the AED is analyzing the patient's heart rhythm.
Do not touch patient. Analyzing rhythm. Shock advised. Charging.
If the AED finds a shockable rhythm, the voice prompt will tell you, and the device will begin charging.
Stand clear. Push flashing button to deliver shock.
Now, push the flashing button to deliver the shock. If you have the Powerheart automatic AED, the shock will be delivered for you automatically.
Shock will be delivered in 3, 2, 1. Shock delivered.
After pushing the button, you will then be prompted to start CPR.
Start CPR. Give 30 compressions, then give 2
The
breaths.
AED is programmed to follow AHA and ERC guidelines of 1 shock followed by 2 minutes of CPR. The Powerheart AED is a non-committed device.
Rhythm changed. Shock
If
canceled.
the patient's rhythm changes after the AED advises a shock, the AED will cancel the shock. Powerheart AEDs from Cardiac Science are the most reliable, easiest to use AEDs on the market today. The Powerheart AED, along with proper training, will save lives. Cardiac Science is dedicated to providing safe, vigilant, and intelligent cardiac monitoring and defibrillation technology to raise the standard of care inside and outside the hospital. Powerheart AEDs from Cardiac Science, the smart choice.